Jeffrey Oakham, coroner. I'll be giving my annual report, and then I'll be turning over to my cohorts. You want to introduce yourself?
My name is Jim Donmoyer. I'm the Director of Lebanon County Commission on Drug and Alcohol Abuse.
And I'm Holly Leahy, Administrator for Lebanon County Mental Health, Intellectual Disabilities, Early Intervention Program.
Very good.
Okay. I'm going to give this year's numbers, and then I'm going to compare them to last year. So I'm going to start, this is for the year 2021. We had a total of 980 cremations. Just to let the new commissioner know, every cremation in Lebanon County has to be investigated before they're turned over to the funeral homes for cremation. So it's a lot of work, but has to be done to make sure that once they're cremated, they're cremated. So anyway.
He's a doctor.
Total number of deaths that we investigated were 498. Out of those, natural deaths were 411, and we had a total of 93 COVID deaths. Accidental deaths, the breakdown, drug-related are 31, which Mr. Dunbar will be going over shortly. 15 of them were motor vehicle accidents. One was a pedestrian motor vehicle.
May I ask a question, sir? Two of the numbers you've said so far are off by one on what the chart says that we have.
Yeah,
Is that,
there's I'll get you a new chart.
so there's a revised chart?
Right,
Okay,
right.
I was wondering which
Yep.
one was right.
Yep, there's one off.
Okay. Thank you.
Yeah, I'll get that for you. So anyway, we had 2 drownings. We had 3 falls, 3 smoke inhalation deaths from fires, and 1 sudden unexplained infant death. We had a total of 19 suicides. The number 1 cause still remains gunshot wounds. We had 11. We had 3 overdose deaths from suicide, and we had 3 asphyxiations by hanging, and we had 2 multiple blunt force trauma suicide deaths. I'll explain that after I finish up here. We had 5 homicides, 2 were undetermined, and we still have 5 pending autopsy results. Just a little explanation that 2 multiple blunt force trauma deaths were probably at least one of the most horrible deaths that I've seen for not only the coroner's office, but for the people who were at the scene, who saw the whole incident. It was a tractor trailer that was going through the intersection, and a gentleman was standing on the corner and jumped underneath the tractor trailer, and all the pedestrians standing by in the corner saw the whole thing. And the other one was a train accident. Lady on the train tracks in her car and remained on the train tracks, and the train hit her car. Multiple people passing by, she waved at them as they passed by, and no assistance was given. Just before I turn it over, just to give you, and the commissioners have these numbers, the number of cremations is astronomical. From 2019, we had 772 investigations. This past year, we had 980. That's an increase of last year of 82. The year before, it was an increase of 126. It's just created an amount of unbelievable work for my office staff.
Is that because of COVID, the last 2 years?
Some of them, but not all of them. It's just more people are turning to cremations now from burials, and I don't think people realize how much work is involved in the investigation of declaring these cases to turn over to the funeral homes. We had to pull all the records, medical records, and it just has created a lot of work for the office. The good thing is accidental deaths from overdoses are down, suicides are down, so that has helped things. Any questions before I turn it over to my cohorts? Or
Any in terms of your relationship with Wells, or working, you know, with those volumes, that seems to be.
Yeah. We have the new morgue that's being processed at the hospital. That's gonna help because the capacity of the morgue right now is minimal. And so we have to keep things, we have so many unclaimed bodies now where people just walk away from their families and we have to take care of the bodies. So we have to we at least give them a week or two to decide what they want to do. And then the morgue fills up and we get calls all the time to get some of these bodies out of the morgue. But we worked well with WellSpan. They call us when they need bodies moved. We also, I like to say, with my cohorts here, work well together and notifying each other of any problems that exist. And I try to notify them of all the cases that we have so they're up to date with them.
Are all of the burial plots that we owned used up now?
Well, we work with Buse Funeral Home and they have a plot for us that we put them all the bodies that are unclaimed are cremated. So we place them in one burial spot. So the families come and decide they want the body, they work with Buse, and so they're easily accessible.
Okay.
Yeah, so it works out well.
Well, that's nice. Do we own the
Yeah.
plot or does Buse own the plot?
We do,
Okay.
we do.
But
And
it's not one cremain per
no,
plot.
no,
I think
no,
is why
no.
we still have some.
Right, capacity, right. I have to commend my office staff to try to do their job in my medical practice and do the investigation of the cremations and working with the funeral homes. And Bob Dowd behind me here is going to be talking a little bit about how we're working with EMA now. Since the First Aid and Safety Patrol went out of the transportation business, we are working with EMA now and transporting the bodies down to Lehigh where we do the autopsies and picking the bodies up at the scenes. And it's really worked well. It was a good transition. We were hesitant at first of how it was going to work, but it's really worked out well. When my deputies are out at the scene, the call's made usually before they get there, well, we're going to need transportation, so Bob's men are in process, and we have our own truck now. If you're driving around the county and see a Lebanon County Coroner truck, that's our truck. We never had one before, so it's certainly gotten us visibility.
Can you tell me, is this new format of what you file with the state? Have we filed with the state?
We always file with the office here, Prothontary.
I know the state requires filing too.
Yeah,
Do you also?
I think they do. They
do you
do that.
file it with the state?
Yeah.
So all that's done, so we're up to speed. Okay.
Right.
I wanted to make sure. Thank you.
I'll turn it over to.
Dr. Yacob,
Yes.
first, two-part question. The cremations, you said that's mandated. Is that a federal, state? local
That's state.
mandate?
State.
mandate?
Mhm.
And then, do we know what the cost is to investigate all these, to actually do the autopsies? For those who want to be cremated?
Well, two separate questions there. Autopsies are separate. We pay Lehigh Valley, which we've been working with for probably 25 years. Jamie, do you know the cost of the cremations? Is it $2,500 approximately?
I don't know.
$2,500 plus transportation costs down. So you're probably looking at $3,000 for a autopsy. And cremations, we are reimbursed for cremations from the funeral homes. And that's part of the funeral home cost. And I think it's $50 cremation that we get, the coroner's office gets reimbursements. And then, of course, we turn that over to Jamie. That's
Well,
Jamie's
we count.
money.
I'll make sure that's on the record.
Good one.
So the coroner's office does produce some revenues. Some.
I just would, to echo what you're saying about your staffing and all the assistant deputy coroners and so on. I mean, that's just, the volume is so amazing compared to your predecessors or
Yes.
Or history. It's
Yeah.
just really.
The coroner's job is not a part-time job.
Yeah.
It's, it's 24 hours a day, 7 days a week. And I'm the one who gets all those calls.
All right,
Could-
well, go ahead.
I didn't mean to cut you off.
Go ahead.
Oh, okay. I was wondering, do you mind rattling off the deputies, who they are, how many there are?
Oh, that's gonna be a tough one. Well,
What are your favorites first?
we have Bruce Rudy.
I'm gonna tell the ones you forget.
Yeah, thank you. Bruce Rudy, he's from Palmyra. Doug Libby. Bruce has been with me the longest, so I'm gonna try to go down the longest longevity.
Oh, I thought Doug would have been.
Doug Libby has been with me the next longest. We have Zimmerman. He was a he is a first aid and safety patrol gentleman, and then his cohort. He works for first aid and safety. He doesn't do that many cases.
Director Dowd, can you,
Yeah, we have Vicki Ham. She works for the district justice. So all of them are part-time. I have no full-time deputies. So we try to spread the wealth around. I shouldn't say wealth, job duties around.
okay.
Do you have the other names, Jane?
Is Janet Bradley still?
Janet Bradley still works with us part-time.
And Daniel Bub?
And Bob, he's a funeral director for Kramer alum.
Should be getting a little something for
Yeah,
this.
yeah, oh yeah, yeah. I think that's it. There are about seven part-time deputies.
Okay, your cohorts?
Oh,
Oh, you're gonna give your,
if you want me to.
What's, just for moral support here, or what?
Moral support. Good morning once again. Again, my name's Jim Dunmoyer. I'm with the Lebanon County Commission on Drug and Alcohol Abuse. Last year I was here at this same meeting to present the 2020 overdose death numbers. And in 2020, if you recall, we had 39 overdose deaths. I'm here today with Dr. Yoakum to present the numbers. For 2021, the total overdose deaths were 31, which is a 20.5% decrease from the prior year. Out of the 31 individuals who died of an overdose, gender, 20 males, 11 females. Race was 24 Caucasian, 6 Hispanic, and 1 other. The youngest individual was 23 years of age. The oldest individual was 63 years of age, for an average age of 41 years.
Can I ask why your number is 31 and the overdose number that was given by the coroner is 3? Why the big discrepancy?
It's down 3.
No, it's,
down 4.
I have a list that Dr. Yoakum's office provided me that have a list of 31 individuals that died from an overdose. I also got this cover letter from Dr. Yoakum that says overdose deaths drug-related was 31. I did not get the chart that you're talking about,
Yeah.
and I don't know what that
Yeah,
chart
that's the one that's
reflects.
gonna be, I'm gonna give you the revised.
Which 3 though are you referring
Yeah,
to?
it says here overdose 3.
Oh, that's suicide.
I,
We're up higher on the chart here. Up at,
The suicides, that's the way, that's the manner that they.
Up under accidental deaths?
yeah, drug-related accidental deaths.
There you go.
There you go.
ah. So you're using the term drug-related, and he uses overdose as a different, okay. I couldn't make it make sense in my head, thank
Drug-related
you.
overdoses.
Okay. So it's drug-related
So-
overdose.
So we had 31. Out of the 31 people, it's really important to note that out of 31, 26 of the overdose deaths involved the use of fentanyl, which is 84% of the people that died in Lebanon County from an overdose involved fentanyl. The other thing that I broke down for everyone here today, when I was here last year, we used to keep track of the person's address, and we used to report that as far as where they died, which wasn't accurate. So what we did this year was we broke it down where the actual death occurred and the zip codes that they occurred. On the south side of Cumberland Street, there was 12 in the 17042 area code. On the north side of Cumberland Street, 17046, there was 6 deaths. In Palmyra, there was 5 deaths, 17078. In Annville, there was 4, 17003. In Myerstown, there was 3, 17067. And in Jonestown, there was 1, 17038, for a total of 31 overdose deaths in the county. This information that I provided on the 31 individuals can be found on the Lebanon County homepage, as well as the LCCDAA's homepage. We have a information. Anyone can go on and access the numbers that I spoke about today.
Thank you.
Thank you.
Mr. Dunmore,
Yes, sir.
there's reports this week that they're finding in the middle school vape units that have been, fentanyl's been added to it. Do you delineate between the ones where someone might have ingested fentanyl without knowing versus, do you get that much into the weeds, versus those who were taking it knowingly, either?
Well, knowingly or unknowingly, if fentanyl's in their system, when the coroner, investigates that death, obviously he does toxicology, and the toxicology report would indicate that there was fentanyl involved. We can't really determine if the person knew it was, or we can't speak to was it intentional or was unintentional. We have no idea of knowing that.
Can I make a comment? Not only am I the coroner, but I have expertise in the drug and addiction field. I have my certification in drug and addiction medicine. I can tell you, speaking to drug addicts every day like I do, the drug addicts pretty well know that almost everything they buy today has fentanyl in it. They don't, drug dealers will tell them it has fentanyl, they don't know that, because they put multiple drugs into the concoction that they give out to their clients. But most of the people who use, quote, heroin pretty well know that fentanyl most likely is in it.
Question, do you ever feel, and you stated that the fentanyl is probably 80% of the overdoses. That's probably in line with state and national numbers?
I would guess to think yes.
That's the biggest
It's
problem.
across the state, it's not just Lebanon County. The numbers are similar across the state. There is one thing, does anybody else have any questions for me? There is one thing that I want to point out to the commissioners and everyone here. There's a reduction of 8 folks, which is great. I always say one's too many, but I believe a reduction of 8 folks in a year is really good work. I want to let the commissioners and everyone know that some of the reasons behind that. I mean, why did the numbers go down maybe? I have some thoughts on that. The first thing I would put out there is that we have a strong heroin task force. They're called Stronger Together. They have a website. They also have all this information on their website as well. They've been more active. They do a lot of prevention events, activities in the community. The reason we try to locate the zip codes is so we know where more work needs to be done. So they're in the field, they're in the streets, they're doing things that are, grassroots type of things. So I want to commend the Stronger Together Heroin Task Force. The other point I want to make is Narcan distribution. In Lebanon County, we distributed over 636 kits in 2021, which is a lot more than we distributed years past. So that's another factor. Another factor that I see is Pennsylvania Counseling Services, with funding from our office, was able to develop a case management unit where they have 7 case managers. They have 2 certified recovery specialists, and these case managers are able to carry caseloads of people that are in treatment. Not only do they have counselors, but they also have these case managers to help them navigate the treatment and recovery process. So that's been a big help. The other thing I have to point out is the warm handoff at the hospital. We have a program at the WellSpan Hospital where it's called Warm Handoff. Crisis intervention meets with overdose survivors, and they do an initial assessment of that person. If that person wants help at that moment, then PCS sends in a case manager that I spoke about earlier, and they get that person hopefully from the hospital to treatment. So that's been helping with, we've seen in the past where people, when we didn't have the warm handoff, people would go to the hospital, they'd survive an overdose, they'd go home and use again, and some wouldn't make it again. So what we're trying to do is, those folks that we know are in, jeopardy, I guess, they come in for one overdose, we want to address that as soon as possible.
Is this what you're doing with some of the opioid settlement money?
We're doing it with federal funds. They're called SORS funds, SORS funds, that come down from the federal government through the state to our office. And then the other thing I'd like to point out real quick is in Lebanon County, we've expanded services in Lebanon County related to MAT, which is medically assisted treatment, which involves buprenorphine, methadone, or Vivitrol.
I just want to point out that we give these numbers to my 2 cohorts here on a regular basis so they can keep up with where the action is happening, so this isn't done just once a year. This happens throughout the year, that we give them these numbers so they're up to date with what's going on.
And you can see that the way it's distributed, that it knows no economic status or any.
Knows no boundaries.
Right.
It's east, west, north, south.
Yes.
Pretty much every jurisdiction in Lebanon County has experienced it.
Are
Okay.
you still doing the DARE program?
I don't believe they are. I've never done the DARE
Oh, you
program.
didn't do that.
I think that was through police.
Sheriff?
Through the police department.
I know South Lebanon Township, in my township where I reside, they used to do it all the time for the
Yeah.
kids. I don't know if that still exists or not.
Okay, I just wondered. Thank
Holly,
you.
would like to comment?
Sure. Good morning. So as far as the Lebanon County completed suicides for calendar year 2021, so the breakdown is that, as Dr. Yoakum stated, there are 19 in total. There were 14 males and 5 females. Out of those, there were 3 veterans. So we do have the VA as part of our suicide prevention task force, and so they ask a lot of questions as far as those individuals. And I know that they are actively trying to assess and assist with individuals with suicidal thoughts and intents as well. By far, the highest method or means was by firearm with 11 individuals. When we look at that, there were 18 Caucasian and 1 Hispanic. We also try to track as far as whether they were known to mental health or drug and alcohol. And so there were actually 12 of those 19 individuals that had a known mental health history. 4 of those individuals were known to our office, MHITEI, and then 5 had a known substance use history as well. When we look where those completed suicides occurred, there were 8 in Lebanon, so that's combined between 17042 and 17046. There were 4 in the Palmyra borough. We had 2 in Myerstown, 1 in Grantville, 1 in Fredericksburg, 2 in Annville, and 1 in Cleona.
Where was the last one?
Cleona.
Cleona, thank you.
Yes. And then we do look at the numbers per month. By far, there were the most completed suicides during the month of October. So we had 5 individuals that completed suicide during the month of October. It's hard to say why, but that was the month. So, as stated, there were 19 this year, down by 2 from last year. But I do want to note that even though the actual completed suicides were down, when we look at those individuals that have suicidal thoughts or intents on a monthly basis or on a daily basis, that those numbers are really quite large. So I'm going to give you some statistics from crisis intervention. Do you have a question?
No, no, no.
Okay, okay. So overall, there were 3,011 individuals that visited crisis during the year. That's an average of 260 visits per month. Out of those, though, we do look at how many are unduplicated individuals. So were there more individuals or less? And so there was actually 208 unduplicated individuals. So that means that individuals were visiting more than once to crisis intervention.
Was that on their own accord, or did somebody bring them in?
It's a combination with crisis intervention. Some are walk-ins, some have family members that bring them in, some are mobile crisis, where we receive a call and someone is in distress and we need to send someone out via mobile to address their circumstances. So it's really a combination of phone, mobile, a walk-in for everyone.
Thank you.
On average, there were over 80 of those individuals per month presenting with suicidal thoughts and intent. So that's all ages. So I don't have a breakdown as far as whether there was a higher number of children and adolescents or a higher number of adults. But that's a pretty large number per month of individuals that are presenting with suicidal thoughts and intent. So they are really trying to address all of that. We're looking at ways that we can really assist crisis intervention with staffing and perhaps some additional services that would really enhance what we're doing within crisis intervention. We also have those suicide prevention efforts that are occurring. We have an ongoing media campaign, and that's a partnership with Wellspan Philhaven. We do a combination of funding, and we put that all together for social media. We do online newspaper, digital bulletin, and magazine. So we really try to get out there as much as possible and get our messaging out there that there really is hope and help, that you just need to give us a call and we will help you. We also have community training opportunities, and so this is really for the community to learn more about mental health and ways that you can really identify someone who may be struggling and may need assistance within the community. Those trainings include mental health first aid, as well as QPR. QPR stands for Question, Persuade, Refer, Suicide Prevention Training. And then we've added Trauma 101. We recognize that so many individuals within our community have experienced some type of major trauma within their lives. And that trauma really drives what they do on a daily basis. And so we need to recognize that trauma plays a large part in how folks are in our community. And then, again, our Suicide Prevention Task Force continues to meet on a monthly basis. We're not as visible during 2021 just because of COVID and what was happening, but we're actively planning activities for this year that we can become more visible in the community at events and everything that is happening. We also have May, which is Mental Health Month, so I know that all of that information will be coming out very soon with regard to May events.
Thank you. Any questions for Holly? Yes, sir.
I don't have any for Holly, but just to back up to either Dr. Yoakum or Mr. Dunmoyer, the other 5 deaths that were overdoses, were those opioid related or caused by other means?
The different drugs?
Yeah, so you had the 26 that were fentanyl related and a total of 31. So what was the other 5 breakdown on that? Is that the opioids?
Well, one of them was amphetamines and methamphetamines. One of them was a mixed drug toxicology, trazodone. Oh no, I'm sorry, scratch that, sorry. I'm trying to find the ones that weren't.
Yeah. I think the most of them are the other ones are combinations, and we're seeing the amphetamines are huge right now, and cocaine. So most of them had the amphetamines and cocaine.
Four actually were cocaine related, and one was actually amphetamine, methamphetamine.
Okay.
So those are the 2.
And the other question is, going back to COVID for a second, there were 93 deaths from COVID this past year. and compared to 116, of course, the virus might have been worse then, but do we know how Lebanon compares to other counties of this size? Because we did have this mask up campaign that ran, and was
Yeah.
just curious as whether or not that was effective compared to other places where they
Can't
didn't
tell
have a
you.
campaign?
Can't tell you,
Okay.
don't know.
And that's a tough comparison because some of those counties are so, they're maybe larger in geography, so there's less concentration of folks. You know, so there's other variables that give you the numbers and so I don't know the answer, but I'm just saying.
I figured that question
Yeah.
probably had an unknown answer,
Yeah.
but
Yeah.
just curiosity.
Yeah.
Well, according to the numbers last night, I believe I looked online and the Department of Health, we had 502 deaths from coronavirus in Lebanon County. Now, that's not all in 1 year. That's over the 2 years, 20 and 21, but it's significant for our population, I believe.
Have we finished? You
Um,
want to comment on that?
no, oh, no. I just wanted to see if Mr. Dowd would like to say a word on our interactions with
Would you like to ascend?
Stay seated. For those who don't know, Department of Emergency Services handles the logistics side of the coroner's office, so we do all the transportation from the scene to the morgue, and then when there's an autopsy that needs to be done, we do the transportation from Lebanon up to Lehigh, where those are done, and then bring them back. That partnership started 2 years ago, and it's evolved quickly, and it's working very well. You know, it certainly is a whole lot more than was initially expected, but I think it's going to continue to be a good partnership, and it certainly has better utilization of county
Hopefully these
resources.
numbers will level out somewhat
Hope.
as we go
Yeah,
forward.
and this year, at least if the current rate holds, it's going to be less than last year.
We bought a truck especially for that, if I
Yeah.
recall.
Yeah,
Correct.
yeah.
Yeah, the ambulance services, they were already taxed. The reality is they just weren't able to continue doing transportation of deceased when we needed them for.
How many miles did you put on?
Oh, boy. In 2 years, that truck has been in service, there's probably 20,000 miles on it already. I'm taking a guess, but it moves.
Yeah, it's-
Well, thank you very much. If there's nothing else, thank you.
And I'd like to thank the commission for all their cooperation with the coroner's office.
You're welcome.
You're welcome. And,
And